you will be the first one. So, friends, I welcome you to this very important and significant session on healthcare. Can healthcare sector become an enabler to steer clear of COVID-19 blues? This session is a part of the second Indo-US Services Summit, jointly sponsored by the Indo-American Chamber of Commerce and the Services Export Promotion Council. Both these organizations have joined hands to bring this summit to you. And as a part of this summit, we are having various sessions on very important and topical matters, both concerning the United States and India, and particularly in the field of healthcare. The session moderator is Madam Upasana Arora. I don't think Upasana ji needs any introduction because she is a dynamic leader in the Indian healthcare industry. Has led Yashoda hospitals since the year 2000. She has been the first Indian working in India to be awarded the prestigious fellowship of ISQA, that is the International Society for Quality and Accreditation. She also holds an international fellowship on health technology assessment from university in US, and she has contributed significantly to ethical healthcare. I can go on and on, but then we don't have that much of time. So with these words, I leave it to the moderator, that is Upasana ji, to carry on with the proceeding. We have one of the most distinguished panel today for this session, and we have none other than, and one and the only one, Dr. Naresh Trehan, the chairman and managing director of Medanta. Actually, Medanta is a misnomer for him because he belongs, you see, to the entire country. He's known all over the country and outside India also. And we have the as guest of honor, Dr. Preeta Rajaraman, health attaché to and regional representative of US Embassy, Department of Health and Human Services. Dr. Preeta Rajaraman has been very cooperative, very supportive, you see, towards the efforts made by the Indo-American Chamber of Commerce. And I hope you see that would continue. And we are grateful for her presence here. And we also have Dr. Mradul Kaushik from the Max Healthcare and Commander Navneet Bali and Mr. Gaurav Pandey. So with these remarks, I pass the proceedings on to Upasana Arora ji. Over to you, Upasana ji.
Thank you, sir. Thank you so much. Good afternoon, everyone.
Good afternoon.
Everybody knows that this COVID-19 has changed whole world, lifestyle. You know, now all the time everybody is in mask and all the time everybody is washing their hands. So it is new normal now that all the time we are supposed to meet each other with some mask. So, but we should not, forget our healthcare workers who made, sincere efforts and who work day and night to save the lives, and without fearing about their own life or their families, they were just busy with the saving other lives, because second wave was really very bad. So today's topic is so relevant, and best part is that we have the best panel anybody can think about, that these panelists can talk regarding healthcare and regarding this COVID-19, because best hospital, best healthcare people, like and best brain of India, even I should say best brain of whole the bird, Dr. Lalit Bhasin has taken best for this session. So everybody is here. So I will not take much time because we have limited time and we have so many eminent speakers who are going to enlighten us. I would request Dr. Naresh Tehan, because he is busy. So I want that you have to please start your speech and kindly guide us how to do next and how to prevent ourselves. Yeah, thank you, sir. Please, over to Dr. Naresh Tehan.
Good afternoon to all my fellow panelists, to Lalit and to you, Upasana ji. Thank you for the kind words, and I would like to thank my fellow panelists for allowing me to go first, because even on a Saturday we have a couple of emergencies, so I had to peel myself away for a little bit. So I actually appreciate your indulgence. So quickly, the whole issue which is in front of us, in some ways, it invokes huge responses of different types in our mind and our surroundings. So today, as you know, that we are going through actually that mid period where we are experiencing that the second wave, which was 4 times the first wave, has got a very fat tail, which is like it refuses to disappear. Like it happened in the first wave, the numbers did come out crashing, but it's not happening right now because we still have 44,000 cases every day, which is like almost half of the first wave. So obviously, on one hand, this second wave is not over. And on the other hand, we are anticipating that the third wave, when is it coming? So this typically is the top of the mind issues in everybody's mind, because the second wave has left us so shaken, and also shown that the healthcare providers, the frontline workers, they have had to stand, I mean, steady in their different spots, different participation in fighting with this pandemic for 18 months now. It's not a joke. People are showing fatigue, people are getting frayed nerves, and I think that there is every belief that a bad third wave will actually crack us all. Not only the medical profession, not only the frontline workers, but the whole economy of our country. So what do we do? Having recognized that at all costs, we should try to minimize, if not avoid, the third wave. Now, typically, as you saw, the distance between the first wave and the second wave, the time distance, was 32 weeks, which is the normal thing that happens in the Spanish flu, and also that we learned from other countries that got the second wave before us. So learning from that, we say, what are the elements that we need to worry about? So the elements that we really need to worry about is, one, what is the numerical height of the wave? Is it going to be worse than second? Is it going to be like the first? Or is it going to be minimum, and there may be series of third, fourth, fifth waves coming of smaller numbers? Today, unfortunately, because we are sitting at a point where the only 3 things that would affect the third wave from staying minimum in size and not being so ferocious was the fact that there must be masking, appropriate COVID behavior at any cost, no matter what we are doing, whether the transport system is open, whether the flights are on, whether we are traveling to work or we're going to the office. If we took extreme care, that would be one element, which I don't see happening yet. People did get scared in the second wave, but they've let their guard down now because they have whatever we call it, fatigue or fed up or whatever you may call it. Whatever it is, it's a danger point. The second thing is that vaccination, which is supposed to have been ramped up, and there were examples of it in one day, it reached 50, 60, 80 lakhs per day. It is now actually averaging around below 40 lakhs a day. So that by itself is also another element which is not keeping pace with what we needed to do to be able to say that there is good hope that we'll blunt third wave. There is out there a model which is called Shakti, which was made by Mr. Subramaniam, our chief economic advisor to the Prime Minister, which says that if we were able to vaccinate 50 lakh people a day, we could reduce the third wave by 25%. We could influence it. And if we could vaccinate 70 lakhs a day, we could probably bring it down below 50% of what it would have been otherwise. And if by any luck we reach 90 lakhs a day, which we certainly have the capacity of delivering, we can do the jabs provided we have the vaccine available and there is less vaccine hesitancy, then we could almost blunt the wave. So anyway, we are not anywhere near that right now, although we were hoping July will see that. Now our next hope is that August there'll be enough supplies and there'll be enough people accepting the vaccine that we can get on with 50, 60 lakh shots a day. So that's the other element, which is an unknown right now. The third thing is the virus itself. Now, the virus itself has shown a huge amount of resilience and shown so far that it is becoming more and more virulent and more infective. In other words, the RO factor, which we look at, seems to be on the rise. It is actually on the rise. And also the Delta plus infections seem to be a little more virulent than previous ones. So having given the fact that we are faced with these kind of mutations which are hanging fire, what do we do about it? So only thing that we say is that if there are not enough people left to multiply the virus in themselves, inside the bodies, then that is the time that the replication of virus and mutation slows down. That is the hope that we say enough people have already contacted the virus, so that there are some sero surveys saying that in India 60% may have contacted it, but there's no proof of it. These are all, hopes, but we don't know what effect it will have. But at the same time, if we could match the vaccine and seropositivity to reach a certain amount, 70 to 80% of some kind of immunity, we could hope that we could actually get rid of this virus. So that till that happens, what are we supposed to worry about the third wave? One of the things that we are seeing, and it is something that we need to pay attention to, is the fact that if you looked at the early days of the wave in New York City, which has a lot of facilities, by the way, but has also a dense population, that they could not cope with the onslaught because there was not enough beds, there were not enough ventilators, there was not enough oxygen, there were no, there was huge problem, and the doctors really went through huge problems. They couldn't go home. They were living in the hospital for 7, 10 days. They were, at that time, the PPE kits were also not perfect. A lot of them got sick. So we should learn from that in India also this thing happened in the first wave because we didn't have all the PPEs and all the other stuff. Then in the second wave that hit us, you know what happened. We thought we were ready for it, but we couldn't because numerically it was 4 times, and then there were not enough beds, not enough oxygen, and then there was this mucormycosis. So many things are happening which you cannot anticipate. So one thing that worries us the most is the fact that the signs that we anticipated, saying that because more and more adults will get vaccinated and the virus may not find enough hosts, that it will target the kids. The kids, unfortunately, are not being vaccinated. And it doesn't seem like they will get vaccinated in the near future. It may be September, October, whatever. So there is a big vulnerable period for children. And we don't have enough facilities in our country to take care of children. And also, the medicines that we need for children are different. Because what we saw is that in the children in the first and second wave was that we did start seeing what we call a multi-organ inflammatory syndrome, which would only respond to immunoglobulin. Now, immunoglobulin is an expensive product, and also it is not readily available everywhere. So if, God forbid, that the children do get infected and X number of them get hospitalized with serious problems, that's when we need to get ready with the hospital facilities, ventilators, the right kind of intravenous drugs, the right kind of supportive drugs. All that stuff needs to be paid attention to right now in preparation. God forbid if it comes, but if it doesn't come, we should celebrate and say, okay, we wasted some stuff. That's okay, but our children got spared. So I think that is the other main concern we have. Now, what can the government do? That's also a very central issue here. So the government recognizes two parts. One is the fact that we hear the banner, life versus livelihood. Certainly, the way it has lasted for almost, it's 18 months now, and we don't know when it's going to end. So it'll be, say, 2 years, 2.5 years. That we do have to move along in a very measured way as we go forward. So if you say, airlines opened, the data collected from airlines should be complete to say how safe were they. Data collected from public transport has to be done very meticulously to say how safe have we been, how much did that contribute to the second wave, will it contribute to the third wave. So all these things have to be put in place. The other thing is that we must have enough facilities to track mutations. And the sensing mechanism in the central government to be able to detect very early outbreaks in small areas where it can be contained before it spreads. Okay. So these kind of things that if we put in place, we'll be able to fight the third wave better than we put the second wave. At least, but today we'll probably be ready to be able to face a wave as high as 3 to 4 lakhs per day. But there are some estimates it may even exceed that. Now, these things will all depend on when will it come, how many people would have been vaccinated by that time, will there be areas which are well vaccinated and then areas which are not so well vaccinated, like what's happening in the United States. Today, as you know, there is a resurgence. There are 80,000 cases today coming up per day. 80,000 is a huge number in a population of 350 million people. So if you look at that, demographically, it is happening only, or the large portion in states that were under-inoculated or states where there was a huge vaccine hesitancy. So if there was any doubt about the value of vaccine, it has now been proven that in a vaccinated population, even if a new wave comes, it is mild, it does not put enough people in the hospital, and not many people will die. So if we have all that benefit, and we know it all, and we have the mechanisms of tracking the viruses, the mutations, and getting ourselves prepared, I think that's all we can do together collectively. And it has to be every aspect of our society. It cannot only be left to the government or the healthcare workers or the frontline workers or the pharmaceutical industry to fight this alone. We are in it together. The whole thing is that we need to come together on this whole concept. As far as Indo-US relationship is concerned, India was lagging behind US in the appearance of the waves. So India, in a small way, did try to support the US, and so US then, when India got hit badly, also helped together. So that just shows that this world has to act one against this deadly virus. It's a common war. Now, where it came from, we don't know. That is a separate debate we can have. But the basic thing is, it's here, and it's creating havoc around the world. So hand-holding with each other. So coming to the current issue. The current issue is how to vaccinate the children. Pfizer and Moderna are the only two vaccines which are approved today, or reliably approved today, or enough people have been vaccinated, children have been vaccinated to say it is relatively safe. So if that is the case, somehow India and the US must overcome this problem of whatever rules, regulations, and indemnities that are required. And I think that both sides should help. The governments have the power to negotiate. I mean, no company can be an island on its own. So I think a cooperation between the Indian government and the US government on this issue will help hugely. They say there's enough supply of vaccine available now with the two companies that are the mRNA platform vaccines. And if that is the one that the children are needed, the sooner we can get it, the better it is. So if this platform can also appeal to both the governments to say, please, let's get on with business, and we must. Preeta Raman is on the panel, and she can be the carrier of the message to her side, and Lalit Bhasin is fully equipped to talk to the Indian side. So let's try to do something, and if I can be of any assistance, I'll be happy to do so. So like I said, sorry that I have to run, but thank you so much, all of you, for this opportunity to share my views. I know that everything is out on TV, and we can just collectively try to fix it. Thank you.
Thank you, sir.
Thank you, Dr. Trehan, and thank you so much. I really like your word, we are one now. So with these words, I would like to now take this session further. I would like to now invite Dr. Commander Navneet Bali, who is Director, Narayana Health Northern Region. Dr. Bali was serving Navy before joining healthcare facility. He has worked with so many other groups also, but right now he is with Narayana Healthcare, and he is co-chairperson for National Health Council of ASSOCHAM, member Health Subcommittee ICAI, mentor of Atal Innovation Mission Niti Aayog, member Delhi NCR Chapter and National Convener Media AHPI, and board member of MedMel. So Dr. Navneet, hand over to you.
Thank you so much, Upasana ji, and thank you so much for inviting me today. It was great to listen to Dr. Naresh Trehan on what he thought was coming. And the topic for today's discussion, as we know, is can healthcare sector become an enabler to steer clear of COVID-19 blues? If you look at the crisis the world has faced from the time that we remember, to the economies of world across, whether you talk about the subprime crisis, then you talk about liquidity crunch, then you talk about natural disasters, you talk about the wars and battles the countries have fought together. Never ever has anything stopped the world, the way this virus has done. And today we are in a situation that about 1.5 years from the day we started this battle against the virus, I think we still don't know how to tackle this virus. We still have found no cure for it. And we still are relying on our basic measures of protection, like wearing a mask, following social distancing, washing our hands. And the only light in the end of the tunnel seems to be the vaccine. So the story is, more or less exactly similar how we started it, except for the vaccine part. The other part of the story is that we are looking at healthcare to steer us, from the COVID-19 blues. And in my viewpoint, since health of an individual has now shown to be one of the most important facets of the economic, not only development, we are now starting about the existential crisis of what the economies across the world are facing. It's not about development, it's not about growth, it is just about remaining there, it's just about surviving, it's just about living. And even if we don't talk about it and we don't say it, because it will unnecessarily bring in a lot of panic inside the public, but imagine the mortality rate of this virus being what it is. If it was anyway even double or treble than what it was, if the R0 or the infection rate, what the virus has today, were to be doubled or trebled, what would have happened? So actually speaking, the world today has stopped in its path towards the speed at which we were going towards. And the basic reason of the entire thing has been that the health of our fellow humans has been affected. And as I said in the beginning also, no other reason ever in our history of mankind has had an adverse, effect than the health of individuals. So having said that, let's now move towards, as the topic of today is that, can healthcare sector become an enabler toward fighting the COVID blues? One thing that we have, I think, realized very well, and as Upasana ji and I think Dr. Trihan also mentioned, is that we are one. Okay, so let's talk about it. Fighting the pandemic, I think, is no longer the job of one one sector of people. I think governments, the society, the private sector, all three of them had to come together to do what we are now doing. And I think even if one of us falters, we will find these waves going up and down. If the government falters, we know what happens. If the society falters, we are already seeing places where people have sort of, with, no blame to them, in the sense that, as it was rightly said, the society is also getting fatigued. And also, I was reading a couple of months back where, the nature of pandemics is such that the society gives up, or the society thinks, or society believes that the pandemic is over much before the pandemic gets over. So that is the second part of the story. And third is the private healthcare, which I think has shown great amount of resilience, great amount of alacrity, and great amount of strength in the two waves that we have seen across the world, whether it is India or it's US or anywhere else, to start treating the patients and start doing. And despite the fact that in the initial parts there was no vaccine, and we didn't even know what we were fighting for. Now let us talk about leveraging healthcare to now move forward, and what can be done, so we are ready for the future, because the pandemic is going nowhere, and we are very well aware that that we are somewhere in the middle of the pandemic. That gives us another 2 years more, where the pandemic becomes endemic, and then we start thinking that, okay, yes, now we've got a handle over it. So first and foremost, I think, despite all the fact that the pandemic throws into us a huge enormous amount of patients which can flock or which can go inside, I think whatever the readiness is needed, I think even now, at some countries, in some places, in some states, even in India, we are still grappling with that readiness. So I think it is still not late. The third wave has not still hit us. And it is a matter of guessing. I think, when will it hit us? What will be the enormity? What will be the mortality rate? Let us do the job that we are supposed to be doing. But I think the good part is that the first wave has taught us, and the second wave taught us more, that, get ready, with oxygen. So most of the hospitals have commission their own oxygen generators, the medicine supplies, etc., would be much better. The second important thing would be to educate the society. So healthcare sector can be a great catalyst to educate the society. Simply, that, let us say the third wave were to hit us, and who are the kind of patients who should rush to the hospital, so the hospitals don't get flooded? What are the kind of people who can be treated at home? Can there be different modalities of treating people at home? Can we see to it that the hospitals don't get flooded the way they were? And also, I think we'd be much wiser to tell the people not to panic. And especially, I think the healthcare sector has got an enormous responsibility, because when it comes from professional, the society believes in it. Maybe they don't believe it when somebody else tells them, but I think that is what it is. The third important thing, I think, which healthcare sector can do, is to leverage the youth of the country. Especially, I'm talking about even students from 10th standard onwards up to maybe college going students, because these are the ones who can, with their own innovative ideas, which the young generation can help us in a big way to educate. Similarly, the other people of the part of the society. And I think we must now start looking at small programs, something to leverage this huge population of young students that we have, to start educating the society. Maybe we are still seeing huge amount of gaps where people are not wearing masks, when people are not following social distancing. And we have seen in the past that when students were leveraged, they were able to bring in some amount of change in the society. And I think the last part would be for the healthcare sector to bring in the faith once more, where people are told that, look at when even the second wave hit us and we had huge number of cases coming in, I think the mortality was kept much below the levels because of an excellent set of doctors, nurses, and paramedical staff across both government and private institutes, which I think were able to control or whatever best they could do, to sort of fight this battle, which was absolutely against an unknown enemy. I think so. The topic revolved around leveraging of healthcare sector to sort of kickstart what is going on, and since it was the health of an individual which affected the economy, it will be now the reverse game back again, where healthcare sector will start, if it starts doing all these 3-4 things. And I think many more ideas will come from other fellow panelists, where we start now slowly moving towards normalizing, getting the economy back on track. And also, if we have third wave or fourth wave or fifth wave, we would have a better handle on the situation, so that both the things run in hand, livelihood as well as the health. Thank you so much for inviting me today for this lovely panel. Thank you.
Thank you, Dr. Navneet. I love your line, do not panic. Actually, it is really required. Do not panic. One should face this. It's a truth of life that third wave will come, and we need to be very careful about that. And I must say that without healthcare, it is not possible to handle this situation. So now we have with us Mr. Gaurav Pandey. Mr. Gaurav Pandey is technology and healthcare professional. He has been working with various patient communities in India and abroad. He has extensively worked with the WHO, UNESCO, UNEX, UNDP, and various other UN agencies in the public health domain. He has forefront the development of and deployment of many successful tech-enabled solutions for public health and telemedicine space. Gaurav Venture, he has worked with many medical associations in Africa to educate and support patients to take care of their health during COVID pandemic times, including Ethiopia, Tanzania, Nigeria, and Somaliland, etc. His company has been setting telemedicine kiosks in many hospitals in Africa to provide single window access to the Indian healthcare system. Currently, his venture is managing one of the largest public health data warehouse solution in the state of Uttar Pradesh. Now, I would like to invite you, Mr. Pandey, and if you want to share your slides, kindly do that. Thank you so much.
Thank you very much. Thank you very much, and good afternoon, distinguished Catherine. It's a pleasure to present my thoughts on the most relevant topic of today's time, the role, responsibility, and journey of healthcare during the time, probably one of the toughest time which our human history is facing. I would like to present my thoughts in form of a PowerPoint presentation. Please allow me to share my screen just a second.
Sure, Mr. Pandey.
I guess this is visible.
Yes, it is visible.
The topic of my presentation, since I come from the technology side, so I would like to give a little bit insight about how the technology has played its role in dealing with the COVID-19 pandemic time, how the technology has evolved from a very basic stage of using artificial intelligence, machine learning, and very innovative, ideas, which has actually helped the medical fraternity across the globe to track the cases, to deal with data, and to figure out what is the best way possible to ensure the increased efficacy of drugs and the medicines which are being supplied to the patients at large. So I have divided this presentation into two small parts. So on one part, I will be describing about a little bit of the growth story of various sectors within the healthcare industry. So telemedicine. Telemedicine has been in existence for so many years, but never got a chance to take driving seat. Apparently, during the COVID time, it has become now the need of the hour. We have seen 500% rise in online medical consultation, and approximately 50 million queries are being generated to take medical consultation, online consultation from various hospitals and doctors across. And 80% of these 550 million queries are from the first time users. So that means the India or the whole of the world is, adopting to the change of shifting from a physical visit to a clinic, then taking an online and medical consultation. which is making the world more connected and more responsive to the healthcare requirement of today. E-pharmacy business has also grown significantly. Pre-COVID time, it was probably more than 99% of Indian households who used to prefer to visit a drugstore for the medicine purchases. However, during the COVID and the lockdown period, approximately 9 million households, they are now regular on various platforms to purchase medicines, ordering medical devices, and various other supplies which are required for their medical needs. Home care is another area which has grown up very, very significantly during the pandemic time, calling nursing support or physiotherapy support at home, taking care of the elderly people or the pregnant women, and even for the child care or a palliative care. So this industry has gone significantly and is expected to touch a $21 billion market size by 2027. So this is what I'm talking about, the technological advancement and the makeshift from the acceptance and receptiveness for the technology intervention in the medical care domain, which is probably one of the positive side of the COVID pandemic, and which could be an answer to the future waves which might hit India or other part of the world sooner or later. The second part of my presentation is I am talking about other technology advancement which has been playing very significant role in handling COVID cases across the boundaries. The X-ray or CT scan is a tool wherein like a technician or radiologist or a doctor can detect a suspected case of COVID and can figure out the stage of a lung during the COVID pandemic. There has been many innovations have been developed in various parts of the world, and these are on use also, wherein a confirmation of COVID or pneumonia cases can be detected by the uses of technology for artificial intelligence and machine learning. Same way, Google has also developed some algorithm which is helping people to detect the early signs of lung cancer and probably bringing more accuracy than the human eyes and human intelligence. So artificial intelligence and machine learnings are the key which can actually propel the medical industry and healthcare industry to see new lights in the coming years. Data is a very important aspect. Like Dr. Trehan mentioned, if we want to see the impact of various mode of transportation or various mode of community connect point, we need to be very, very scientifically analyze the data associated. What parameter is impacting human lives with regard to the current pandemic or the future possibility of the third wave, or could be more, instances of COVID cases. It is important to figure out how the data is captured and how we are dealing and analyzing the intelligence out of this. So data science has been helping a lot in the healthcare industries during the pandemic time, and a lot of innovations are also coming up with the solutions which can deal with the larger volume of data. Even in US, the government is investing hugely on patient health records, which is also bringing out many intelligent idea and insight about future health problem. Classic example, if you want to suggest a newly diagnosed cancer patient about a treatment plan. So there has been data science studies in various parts of the world, which is helping patient to figure out what is to be done when a patient is detected with a cancer. So this is just one case. There are many more. So data is also evolving and bringing intelligence to the healthcare industry, which is also a positive outcome of COVID situation. We do not have the habit to maintain an electronic repository of our medical records. It is important that we should be capturing our medical records throughout our lifespan so that we can track an individual's health and we can figure out what are those parameters which can actually make them a vulnerable or a potential health problem in future. So this is important. In fact, in our company, we also have developed a mobile application wherein we are giving and providing digital locker services to our patients wherein they can store their health records And then there is an artificial intelligence and machine learning based layer, which reads on the data provided by a patient and alert them so that a future health problem can be prevented at a very early stage. In individual health, we always talk about primary and preventive health care, but we need to adopt a scientific approach. And that is what is happening during the pandemic time. There has been many protocols by reputed institutions such as Mayo Clinic, various other public health bodies. Those public health programs and many tools are helping to figure out the health risk assessment of an individual. We need to figure out the parameters which are affecting an individual's life, and there should be a way to monitor and track the health status of an individual. And this is not only relevant for COVID, but also for the other health related issues. So again, it is more of a scientific evaluation of a data related to various parameters of an individual. Which is going to play a very important role in ensuring primary and preventive health. In US, Walmart has opened a very big health mall, which provides all healthcare services under one roof. It's a physical setup. So that's how there is a requirement for various technology companies also to provide all healthcare solutions under one umbrella, driven by SOPs and protocol, which can actually standardize the healthcare offering. Healthcare is always a subjective call. One physician can see a problem from a different way, and another physician's observation can be so different. While the medical care industry is so mature in nature, we have protocols, we have SOPs in place, which can actually make it very scientific, very standardized in nature. And at the same time, patients should have a liberty to choose the service provider of his choice under one umbrella, so that all healthcare linked services, if I take a medical consultation, I should have a solution to take or buy medicines, to book pathologies, to order any other services which are associated. So the healthcare offering can be a complete solution and complete package to the end customer or a patient. Monitoring and evaluation. Now, when we talk about delivering medicines at doorstep, when we talk about home care solution, when we talk about any other public health solutions, including elder care, managing pregnancies, maternal and child health, and various other health programs, it is equally important that we should have a technology backbone which can help us to monitor and evaluate the impact of every household visit of a health professional. While we are working to develop skilled manpower to get prepared as a corona warrior, to deal with the epidemics, to deal with the localized communicable disease problems, to deal with various other non-communicable disease problems, it is equally important to use the technology backbone to ensure that the delivery of healthcare services are as per the SOPs, as per the protocols, and as per the guidance. So, my submission, when we have mobile phone available in each one's hand, when we have internet connectivity available across geographies, even the remotest part of India or probably remotest part of the world is now equipped with internet technology, it is the best time to deal with solutions wherein we can invest in data, we can invest in data science, we can invest in artificial intelligence and machine learning solutions, which can push the healthcare offering so that the mass population in this world can get benefited out of it. So this is my submission about how a technology clubbed with healthcare offering can become an enabler for the economy revival, for the human lives revival during the pandemic time. Thank you very much.
Thank you so much, Mr. Pandey. It was very different talk, because when we talk about our, traditional healthcare system, and now technology has taken over, and it is very helpful. Thank you so much. Now we have Dr. Preetha Rajaraman with us. So now I will invite her. She is a health attaché and South Asia region representative for the US Department of Health and Human Services. served as a key advisor to US Secretary of Health and Human Services and the US Embassy in India on matters involving health and biomedical research in South Asia. She is responsible for in-country representation, monitoring and coordination of the policy, program and interest of all HIS agency, including the Center for Disease Control and Prevention, the US Food and Drug Administration, the National Institute of Health. Over a broad portfolio spanning health policy, non-communicable and communicable disease, health safety and security, and research and innovation. Dr. Rajaraman previously initiated research program and policy at the US National Institute of Health's National Cancer Institute, where she received the Director's Award for Exceptional Leadership, fostering cooperation in cancer research between scientists and the United States and India. Her research on the interaction between genetic susceptibility and environmental factor in cancer has resulted in over 130 peer-reviewed publications. She is an expert advisory member for various international bodies, including the International Commission of Radiation Protection, the World Health Organization, and the Lancet Oncology. She holds a PhD in epidemiology, Johns Hopkins, on MSc in Environmental Health, University of Washington, and a BA in Biology, Reed College, Phi Beta Kappa. Preetha ji, when I was reading about you, it is so much how much you have, you are such a learned person. So kindly enlighten us with your thoughts. Thank you. Over to you, Preetha.
Thank you so much, Upasana ji, and thank you so much for inviting me to this panel. I've really learned so much from every one of your speakers. I've really been enjoying the insights actually from just very different angles. So I think, as you had already mentioned, I'm here, of course, representing not only my secretary, but all of our health agencies. And in fact, if you look at our entire bilateral cooperation with India, one of the strongest and really longest standing ones has been in the health sector. And as you can imagine, that has really been so focused in the last year. And, this brings us to this very urgent question that you're asking right now, which is, what role can this health sector play in bringing the pandemic to an end? So I think, all of us have seen, as how quickly the SARS-CoV-2 or the virus that is responsible for COVID-19 has spread across the world. These viruses see no boundaries, and frankly, neither should we. In all of our lifetimes, I think very few of us have seen anything like this in terms of a global public health disaster. It's not only put human lives in danger, but it's disrupted livelihoods, harmed trade, the economy, enterprises all over the world. And in addition to the tragic and really almost universal and very personal losses that we've all faced, the global economy has also experienced significant disruption and is on the verge of a severe recession and really almost an economic disaster in some ways. I think theoretically, all of us know and we've heard that the global economy is deeply linked and it's interdependent via these global supply chains. And boy, have we seen that up close and personal during this COVID pandemic. And I think if you really look at how this pandemic has affected the world, all of our countries have been affected, but India and other South Asian countries have had to deal with additional challenges: large populations, uneven health systems, high poverty rates, social protection systems, areas where we don't have access to water and sanitation, and some areas with crowded living conditions, all of which make, these very, very powerful public health tools that we've been hearing about from our other speakers are very difficult to implement when it comes to India. What does it mean to say socially distance, when you are in a small house living with 11 other people? And so, all of these challenges have really affected our ability to prevent, to detect, and to respond to this pandemic. Certainly, some of the early policy decisions, such as the extended lockdowns, helped initially to limit the spread of the virus early on. But, we've seen that those measures came at a high economic and a high social cost. And if we're really looking long term to see how can we contain this virus and how can we prevent this in the future, we're probably going to need a different and a more nuanced approach than some of those early sort of more, hammer-like approaches. Coming particularly to the healthcare industry, sort of where we've been, where we're going, faced with this pandemic, we've been shown an uncomfortable truth. Globally, the healthcare sector was simply not prepared to deal with the public health crisis of the magnitude that we're seeing. Our existing practices, whether they were in terms of regulation, infrastructure, risk management, sourcing, procurement, supply chains, they've all been put to the test, and we have found that they were lacking. One of the particular vulnerabilities has been the lack of understanding of how things that are happening at a global level affect very local issues and implementations of healthcare. Lack of vaccine equitability means, as I think Dr. Trehan was mentioning earlier, that vaccines are available for children in some parts of the world, not in other parts of the world. And so the interconnectedness of our global health systems is an issue that we are now realizing that, whether it's for this pandemic moving forward or really for any future pandemics, we're going to have to need to address. So in terms of this major supply-demand imbalance across the world, we've seen that manufacturing plant closures have resulted in a lack of medicines, testing kits, other crucial supplies, putting all of our global medical supply chains at risk. One example, which of course we keep hearing about, is the global manufacturing, supply, and distribution of vaccines. So that leaves us with the key question of, well, how do we fix these issues? How do we make sure that we can, start mitigating the current pandemic and be prepared for any future emergencies such as that? So let me tell you what we're doing as the US government to begin with. Certainly over the last decade, all of our US health agencies have actually been working very closely with the government of India and our other Indian counterparts to build systems to strengthen healthcare as well as pandemic preparedness. And over the last 18 months, of course, these efforts have really intensified. But the reason I bring up the fact that we've really been doing this for decades is this is not something you can turn on overnight. What we do today is going to affect what happens 5 years from now. And it's the systems that we're putting in place right now that will tell us how we respond to a future pandemic. So, as we've worked with the government, academic, private sector here, some of our particular agencies, such as the Centers for Disease Control and Prevention, or CDC, have been looking really at grassroots, field level, working on how do we strengthen outbreak response? How do we build the public health workforce? How do we build disease surveillance systems? Also, in terms of hospitals and healthcare, how do we share knowledge on infection prevention control? How do we improve laboratory diagnostics? So all of these are just very practical ways of how do we just strengthen our ability to fight infectious diseases. On the other hand, if you look at, well, what's coming next, our National Institutes of Health, our biomedical research organization, through a very long-standing program known as the Vaccine Action Program, but as well as other activities, has been supporting the development of new vaccines, therapeutics, as well as diagnostics to battle COVID-19. Finally, one of our agencies that many of you, of course, have worked with, our FDA, has been working with our Indian counterparts here to share information, best practices on the regulation of all of these devices and vaccines, therapeutics as they arise. One of the questions that came up, I think, from one of our previous panelists was, well, what are we doing on vaccine manufacturing and supply? And in fact, in coordination,
I'm so sorry, Preetha, we have to wrap up because time is very less. So we
Okay.
need to kindly cut short your things. Yeah.
Okay, so let me just finish off by saying that we've been working with the White House just to tell you at what level these discussions are happening to make sure that we increase the global supply. But I think the issue, maybe the last thing I'd like to leave you all with as we wrap up all of this, is it's not enough to develop all of these. It's to share the knowledge and to make sure everybody has access to these. And to realize that equity and access is as important a part of all of these discussions as the setting up of these systems. So I look forward to working with all of you to face the challenge that we're currently in, but also prepare ourselves for future challenges. Thank you.
Thank you. Thank you so much. And I am really thankful to Indo-US Chamber of Commerce that they have given me this opportunity, that I can sit with all of you and I can listen all the dignitaries who are really torchbearer of healthcare. And thank you so much. And definitely we will arrange another meeting for such kind of topic. Is very hot and very relevant these days. Thanks. And with these words, I would like to say thanks to all panelists and US Chamber, same time SCPC also, because they are partner with this. Thanks a lot. Thank you so much. See you soon. Keep safe, stay healthy.